Tom Price had one job: to kill Obamacare. And as Congress failed to pass repeal legislation time and time again, Tom Price mounted an unprecedented sabotage campaign. He cut the open ACA enrollment period by half, from 90 to 45 days, slashed funding for Obamacare advertising by 90%, according to Vox, and the funding for navigators that guide people through the sign-up process got sliced by more than 40%. Then on top of that, the department is shutting down healthcare.gov, the federal health insurance exchange, nearly every Sunday during open enrollment for 12 hours at a time. And for the very first time, regional representatives from HHS will not be allowed to participate in state open enrollment events. Tom Price's zeal to undo the ACA was even specifically noted by the Speaker of the House, Paul Ryan, today, who, in mourning Price's resignation, wrote, quote, "His vision and hard work were vital to the House's success passing our healthcare legislation." But now that Tom Price is gone, what happens to the Republican efforts to kill Obamacare? Julie Rovner is the chief Washington correspondent for Kaiser Health News. And Julie, I want to start with the context here, which is just how dogged HHS has been in attempting to dismantle a program that it is statutorily tasked with administering.
That's right. HHS has on its website a number of videos not talking about how to sign up for healthcare, but talking about how Obamacare has failed. I mean, they're basically, their entire message, almost every week you get another press release, not about what they're doing, but about how Obamacare isn't working. And now they're taking every effort, as you just detailed, to make sure it doesn't work, in particular to make sure that healthy people don't sign up. Sick people are going to find a way to sign up. They know they need insurance. They want it. It's the healthy people who have to be reminded that the time for open enrollment is different and that there are different deadlines and so that may need extra help signing up. Those are the ones who are going to not sign up as a result of all of this.
And I want to be clear, what does that mean for people who need health insurance, who are purchasing it through the exchanges, if healthy people don't sign up? What does that mean for their bottom line?
It means that premiums are going to continue to rise because there will be no healthy people to spread the cost across. We're already seeing huge premium increases this year just because of the uncertainty, because the administration won't say every month whether they're going to pay these cost-sharing subsidies that the insurance plans are required under the law to provide, and that the administration is required under law to then reimburse them for. But there was this lawsuit about whether or not there was actually an appropriation or whether it needed to be an appropriation. So every month there's another piece of uncertainty. That's added 20% to premiums around the country.
I wanted to show this, just an example of what that looks like. So this is in Idaho. Let's say you're in Idaho. These are the premium increases statewide. So bronze, 8%, not reasonable. Silver, 40%, that's huge. Gold, 9%. Now, why is that 40%? My understanding is that those are the plans that these cost-sharing subsidies apply to. So this is just a direct cost inflation from what HHS is doing to customers.
Exactly. And it's going to have sort of a perverse effect on the market. People are going to be able to buy gold plans for less money than it would cost them to buy what should be a less generous silver plan, because those subsidies are pegged to those silver plans. It's distorting the market in a really major way.
How much was Tom Price the mastermind for this?
I think he was some of the mastermind. He's certainly been, one of the most outspoken opponents over the last 7 years against the Affordable Care Act. And certainly they've done some administrative things. One of the things that hasn't really been noted is that they offered states the chance to do these waivers, to let states sort of do their own thing. But then they sat on a bunch of the waivers. There was another one just today that got withdrawn because HHS didn't act on it.
Oklahoma tonight basically says, Oklahoma, red state Oklahoma, basically just said to HHS tonight, we applied for a waiver and you literally never got back to us, so we have to pull it back because you guys are just ignoring your job, basically.
That's right. And Minnesota was promised its waiver weeks and weeks and weeks ago. It finally came through last week, but HHS said at the same time that they were taking almost as much money away through another program as they would have gotten through the waiver.
So then the bottom line is, how much does this become the topic of the inevitable confirmation hearing when they have to appoint someone to replace Price?
Oh, I think it's totally the topic of the next confirmation hearing. No matter who it is, there's talk of people who have already been confirmed by the Senate, whether it's Seema Verma, who basically is in charge of the Affordable Care Act, or Scott Gottlieb, who's at the FDA. But no matter who it is, I think this is what is going the hearings are going to be a proxy for what the administration has been doing to undermine the Affordable Care Act.
All right, Julie Rovner.